sickle cell disease. So sickle cell disease is passed on from both parents. It's a genetic disorder, and both parents have to have the trait to pass it on to the infant. Okay, so what happens in sickle cell? They're born with this genetic trait, and they have an abnormal hemoglobin. It's called hemoglobin S, and it makes their normal red blood cells go up to pathology, turn into a sickle shape. Okay, so when the cells are in a sickle shape, they can clog up the blood vessels. Okay, they don't pass easily through the blood vessels, so it's called vaso-occlusion when these clumps get together and they occlude the blood flow. Because of that, the signs and symptoms are going to be splenomegaly, because these sickle cells get caught in the spleen, and so then the spleen gets very big and bloated, and the spleen filters our blood and helps prevent us from getting infections. Well, in a sickle cell crisis, the blood is not going to be flowing through the spleen as well, so people with sickle cell disease are at high risk for infections. So with signs and symptoms, the next one is infection. You can remember the mnemonic sickle, so that's what I'm following. They can develop cholelithiasis, and that means gallstones. And they can have hematuria, okay, from the kidney, which means that these sickle cells could be clogging up the kidney. And then L is for liver congestion, which can cause jaundice. But also when the blood cells lyse, that releases bilirubin into the blood, which can also cause jaundice. Leg ulcers are very common in people with sickle cell disease, and they can be very painful. When they have a sickle crisis, it's also extremely painful because, as you can imagine, when these sickled cells get congested in the blood vessels, that can be very, very painful because it's cutting off oxygen to the tissues. They can also have eye changes, okay, so they have problems with their eyes. Pain during crisis is something you're going to have to manage, and they can have swelling of their hands and their feet. So the risk factors I talked about, you have to have two parents with the trait. People can have just the trait and pass it on, but it takes two parents with the trait to pass it on to their children. Now, triggers of a sickle cell crisis include being at high altitude, smoking, vigorous exercise. Now, if you think about it, these three things I just mentioned can cause a decreased oxygenation of the blood. So the patient can become hypoxemic. Smoking causes vasoconstriction. So those can be triggers. In addition, cold liquids, cold room, cold temperatures can also cause vasoconstriction, which can further increase clotting of the cells in the blood vessels. Also dehydration and sickness. So if they become stressed with sickness, they can also have a sickle cell crisis. So complications, I talked about infections. They can also have a stroke as these blood vessels get caught in the brain, the brain vasculature. They can get upper respiratory infections because they're going to be prone to infections, leg ulcers, and splenomegaly. I talked about that. The pain, abdominal and long bone pain is the type of pain they can have. They can have hand and foot pain, joint pain, as well as the cells clump, okay? And it causes a vascular occlusive crisis. The treatment, remember to hop to it, okay? Hydration, oxygenation, and pain relief. They need to get to the hospital. Blood testing, they'll do some blood testing on infants to look for the abnormal hemoglobin. And I talked about the treatment, and that's a quick disease sheet about sickle cell disease.